Our next speaker is Dr. Nitesh Kumar Marshall. He will be presenting on the prevalence of childhood blindness and ocular morbidity among children less than 16 years in tribal population.
Good morning, everyone. My topic is prevalence of childhood blindness and ocular morbidity among children under 16 years of age in tribal populations. I have no financial interest. Introduction. Blind child is defined as persons under 16 years of age, corrected visual acuity of in the better eye of less than 3 by 60, counting finger at 3 meter, or a central visual field of less than 10 degree. According to WHO globally, 1.4 million children are blind and approx 19 million are visually impaired. Economic blindness is defined as vision in the better eye less than 6 by 60 to 3 by 60. Social blindness, vision in better eye of less than 3 by 60 to 1 by 60. Legal blindness, vision in better eye of less than 1 by 60 to PL. Total blindness is defined as there is no light perceptions. Available blindness includes preventable blindness and curable blindness. In India, the prevalence of childhood blindness is approx 0.8 per 1000 under 16 years of age. Category and percentage disability. One-eyed person 30% for benefits. Correct categories of vision impairment: normal 6 by 6 to 6 by 18, moderate visual impairment less than 6 by 18 to 6 by 60, severe visual impairment is less than 6 by 60 to 3 by 60. Major global initiatives for the prevention of blindness: WHO Prevention of Blindness Program, Vision 2020, the right to sight, Vision for the Future, Universal Eye Health Global Action Plan. Aim of the study was to evaluate the prevalence of childhood blindness and ocular morbidity under 16 years in tribal population. A cross-sectional study was conducted in which 678 children from tribal populations who attended out an inpatient department were screened. This study was approved by the Institutional Review Board of the hospital, in which ocular examination was done, IOP was recorded, fundus examination was done, and child with a history of night blindness were thoroughly examined to rule out vitamin A deficiency. Statistical analysis was performed using SPSS version 22. Result: in the 678 children studied, the prevalence of ocular morbidity was 70.65%, in which 33.78% were male and 36.87 were female. Refractive error was the most common cause, 38.05%, followed by allergic conjunctivitis 12.24%, vitamin A deficiency 8.70%. Out of 70.65%, in which 38% refractive error, 12% allergic conjunctivitis, and approx 9% of vitamin A deficiency. This is shown by the line chart. Sex-wise distribution of ocular morbidity: 33.78% was male and 36.87% was female. In male candidates, approx 18% has refractive error, 5% allergic conjunctivitis, and approx 4% of vitamin A deficiency. In female candidate, approx 20% have refractive error, approx 7% of allergic conjunctivitis, and 4% of vitamin A deficiency. In 258 out of refractive error, 21.53% of myopic, 7.82% of myopic astigmatism, 5% have hypermetropic, and approx 4% of hypermetropic astigmatism. Group in between age group 0 to 5 years, the total prevalence was 6.49%. In age group between 6 to 8 years, 16.8% prevalence. In age group 9 to 12 years, total prevalence was 22.42%. In the age group 13 to 16 years, total prevalence was approx 25%. In age and gender-wise prevalence of blindness and visual impairment in children: out of 678 children screened, in which 9 children was blind, in which 5 was male and 4 was female, and moderate to severe visual impairment was present in 21%, and mild visual impairment was present in 26% of children. Discussion: the prevalence of ocular morbidity was 70.65%. The present study shows a rise in ocular morbidity with increasing age, which was comparable with the study conducted by Kumar et al. However, the study conducted by Desai reported a decline in the ocular morbidity with increasing age, which did not match with the results of our study. Gupta et al. Reported a 31.6% prevalence in Simla. Chaturvedi and Agarwal study reported a 40% prevalence. According to anatomical cause of blindness using WHO Prevention of Blindness and Low Vision form, due to the criteria of presenting visual acuity in the better eye, 47% child had visual impairment. Among the 9 blind children, a total of 3 had optic nerve abnormality, 3 had retinal abnormalities, 2 had corneal and 1 had lenticular abnormalities. In the 143 children with moderate to severe visual impairment, a total of 87 had retinal changes, 27 were amblyopic, 16 were uveal coloboma, 18 were cornea scarred, and 2 were anophthalmos. The prevalence of visual impairment is also influenced by the definition of blindness and visual impairment. In this study, the criteria of used was presenting visual acuity less than 3/60. The comparison of various studies with my study. Conclusion: refractive error is still most common cause of visual impairment. There is need to create these are my references. Thank you.
You found about 35 cases of hypermetropia.
Yes, sir.
So many were unilateral?
Yes, 35 so sir, 18 cases are unilateral, sir.
17 and 18, no? 17 male, 18.
Yes.
So out of 35, how many were unilateral? Why I am emphasizing, earlier also I emphasized, unilateral hypermetropia at this age, children must be detected. If not detected, it will lead to amblyopia and non-treatable. Otherwise, bilateral will present to the ophthalmologist. Similarly, other refractive will present to the ophthalmologist. So, main crux of school health program or children is unilateral hypermetropia must be detected and should be treated so that they don't develop amblyopia.